Hi guys. Hello. How is everybody? What? Everybody good? Okay. Can you guys hear me in the back? We'll wait till she's off the phone. Or we can say hello. I'm Dr. Cater. I'm the one giving your workshop tonight. Can you tell? You know why they picked me to do the workshop? Because I said I had a big voice. So I'm going to do your workshop for you tonight. Everybody okay with that? Welcome to summer. You notice that no one's doing this walking in here though, right? So we should all be a little bit happy no one has to shovel yet. You don't have to fill those out yet if you don't want to. Okay? I can sit down with you then. Good. Everybody, they took you.
You don't have to if you don't have to.
If what? You don't have to if you don't want to. I'll explain that when we're done. But there's a lot of different doctors that work in our office, a lot of different therapists that work in the office. I'm doing the workshop for tonight. So,
Are you a doctor?
I'm one of the doctors in the office. Yeah. You guys can hear me, right? Why? Because I'm short? You said wow?
No, you look.
Because I'm cute?
No, you don't.
Oh, okay. No, I'm not hired entertainment tonight. I'm actually here to give the workshop for you, okay? I'm just going to ask this as a courtesy because you guys took the time to come out into the cold. You guys took the time to come here tonight to learn for one reason. Just as a courtesy, just like I would be if I'm with my daughters, I would ask them, could we be present tonight for at least 20 minutes and then you guys can eat, okay? I'm just going to ask if you can put your cell phones on mute or vibrate. But don't have too much fun if it's in your back pocket and it's vibrating, okay? Okay, so I'm going to start. You guys can all hear me in the back? Okay, so my name is Dr. Kaner. I am one of the physicians in the office. What I'm going to, you guys, some people go, I don't know how to shut my phone off, right? You got it? You have 3 phones. Okay. Okay, so you guys ready? All right, so you know what today's date is? Today is January 12th. Actually, today is the 8th day. Today is the 8th day past New Year's resolutions where most people give them up. You know what January 4th is? January 4th is the largest chocolate consumption day. And most people go off their New Year's resolution by January 4th. So honestly, I love giving this workshop this time of year because it's still in January, because most people are still not dedicated or committed, I should use the word committed, to getting themselves healthy. Okay? I am going to tell you my background now as opposed to at the end. And you're right in front of me, so I'm going to be touching you a lot tonight.
Oh, yeah.
Yeah. Okay. I'm a taken man. I'm going to tell you my background now so you don't ask me at the end, because at the end I am going to come around and answer certain specific questions for you individually. My background is in nutrition. Then I went into physical therapy. I became a chiropractor and I'm a patient coordinator for the medical office that, actually our office is right down the street. It's right next to Johnny and Haynes'. Okay? Tonight's workshop is not about a nutrition class. So enjoy tonight's meal. It's not also the Last Supper, but I am going to tell you that nutrition in your life is very important. And every ache, every pain you have in some way, in some fashion, is directly related to how you eat. I got a lot of oohs and ahs, right? Most people don't like hearing certain things, but I'm here to tell you the truth tonight. Here's my background. And some of you look familiar, but I look familiar? Right. You've seen me before. Uh-oh. I do a lot of corporation company speakings. I also do a lot of workshops for people, individuals, and schools, because our goal is here with your own life. You should be wanting to find someone that's here to take care of or help take care of you. See, most people don't need more doctors. And I work for Dr. Riley. That's Dr. Riley, by the way. I work for Dr. Riley. Most people don't need more doctors today. What they need is better health coaches. See, the healthier you are, the more happy people are. The healthier you are, the less aches and pains you have. Here's my background, because I'm going to speak for 20 minutes and I'm going to keep him up. Because your goal tonight is just not here to eat. And out of love and respect, I'm going to treat you the same way I would my own family, because we're all the same family. My dad is from Brooklyn, New York. Okay? My mom is from Meridian, Mississippi. I don't sound like my mom, but I can tend to speak fast. If I'm saying something that you need to be repeat, just raise your hand and I'll come and I'll repeat it. Everybody okay with that? Okay. Most people don't realize how important their health is. And most people don't realize how important their health is until they start losing their health. My background is this. Everyone in my family had heart disease. Okay? Both my parents had cancer. To the grace of God, they're still here. Okay? But both my parents had cancer, and most people, okay? We do it. We can do CPR if we need to. I'm going to repeat this, is that most people don't realize how important their health is until they lose it. Tonight's workshop is not just to stay warm. Tonight's workshop is not to come out to dinner with just your friends. You actually signed up to come to this class for one reason, for one purpose, for one main mission, and that is to get yourself out of pain or to realize why you're having certain aches and pains. Tonight's workshop is supposed to be about headaches and tingling and numbness in your hands. Just for a show of hands, how many people get headaches? Yes? How many people here have pain, sharp, shooting, spastic, or tingling sensations in their hands? Yes? Okay, in your fingers? Anybody wake up here in the morning have to shake their hands out? Okay. Anybody here feel dizzy? Okay. Anybody, and listen, there's no, watch this when it comes to your health. There's no weight limit to get into heaven. And thank God there's not a height limit, because I'm not the tallest man. But if I need to stand up here and talk and get people's attention, guess what I do? I'll do it. Because you hired me to help you. You're not here for your past health. You're here for your future health. Right? That's why you're here. How many people here actually get low back pain? Raise your hand. Oh, wow. Low back pain. Okay. I'm telling you right now, you're here to learn 3 things. 3 things. Okay? If you learn 3 things, I felt I did my job. Most people, again, their health is the most important. And I know this. When you have lower back pain, these nerves in your lower back supply the muscles to your lower back. These nerves in your lower back supply the nerves to your lower back, your legs, your ankles, your feet, and your toes. With a raise of hands, how many people here get sharp, shooting, tingling numbness down their legs or into their toes? A lot. Okay. I'm going to say certain things that you might not always like to hear, right? But I'm here to teach you so you can get better and make better health choices. All right? First of all, understand that pain is your body's natural way of telling you there's something wrong. Does your body tell you when you're hungry? Yes. And they're bringing out the food in 20 minutes, so that's all you get me for. Your body tells you when you're hungry. Your body tells you when you're thirsty. When you have pain, I'm 47 years old, going to be 47. I have 2 teenage children. And I never really knew my grandparents. But I want to be around to see my kids grow up and my grandkids grow up, right? But we know this, is that your pain is there for a reason. I grew up, like a lot of you did, that if you have pain, that's something wrong. And you should just take Motrin or Advil or Celebrex or Vioxx or Bextra or just take medication to cover up your aches and your pains. Your body gives you a signal of pain, not just to shut it off. Does it make any sense if I'm riding in my car, my engine light goes on, and I take a marker and I cover up the engine light so you don't feel the pain anymore? No, but that's what a lot of times what people do. Okay? So I'm going to ask you to leave here 3 things. Here's the biggest misconception when it comes to health. Tell me if I'm wrong. Dr. Riley taught me this. The biggest misconception when it comes to health is this, is most people think they're healthy just until they get diagnosed. I'll say it again. Most people think they're healthy just until they're diagnosed. See, the worst symptom is no symptom. I'll say it again. The worst symptom is no symptom. How do you know? Is there any nurses or doctors here? Anybody in the health field? Yes? Good. Now you're on a spot, girl. You can finish the rest of it. Watch this. Okay. How do you know if you're healthy? And I'm doing this to get your attention.
Your body tells you.
You what?
Your body will tell you.
Yes.
You get up in the morning.
You get up in the morning. Okay, so how would you know if you're healthy or not?
My body would tell me.
Your body wouldn't tell you.
Would tell me.
Would tell you. Okay, how do you know if you're healthy? What do you think most people say?
Symptoms.
What?
I get symptoms.
Symptoms? You agree? Yeah. So what would you say? How would you know if you're healthy or not?
You don't feel any pain.
The doc, what do you say?
You don't feel any pain.
When you don't feel any pains. Okay, so if I said I want you to leave here learning 3 things, here's one of the most important things I want you to leave here tonight. Whether you have back pain, neck pain, asthma, allergies, if you have headaches, if you can't sleep through the night, if you have constipation, listen, when you have pain, it's your body's way of telling you something wrong. How do you know if you're healthy? This is one of the biggest things that any doctor could teach you. You said it exactly right. I don't feel any pains. Here's the worst way to judge your health. The worst way to judge your health is how you feel. Because a lot of people say, I feel good, and drop dead. No, did I get your attention? Right. So watch this. The worst way to judge your health is how you feel. Because you can feel good right now, walk out of here and have a heart attack. When my mom got diagnosed with cancer, guess how she felt? Fine. Can I have prostate cancer right now and feel fine? Yes. Can you have breast cancer right now and feel fine? Yes. Can you have a clogged artery in your carotid right now and feel fine? Most people can feel fine. You have a clogged artery. Can you have high blood pressure and feel fine? Yes. So I can have prostate cancer. You can have lung cancer and feel fine. The worst symptom is no symptom. Okay. How many people said, oh my God, I just had lunch with them yesterday. I just saw him. Or they'll say something like, they exercised all the time. Or they looked like they were healthy. They were a lacto-ovo-pesto vegetarian. They ate everything organic and they dropped dead like this. So symptoms are the last thing to show up. What's that? Your symptoms are the last thing to show up. First your immune system breaks down, then you get cancer. First your immune system breaks down, then you get a pain. What's the number 1 disease killer today? Diabetes? Are you talking about type 2 diabetes? I'll tell you, the first disease killer, the number 1 killer in this country is heart disease, and it kills 1 of every 2. It kills 1 of every 2 people in your family and my family, right? So 1 of every 2 people in this country drops dead to heart disease. What's the second disease killer? Somebody said it. Right. Remember, give me a C. C. It's like charades. Right. Cancer. Cancer kills 1 out of every 3. So you had a 5 out of 6 chance of developing heart disease and cancer in this country. And that's in this country. Watch this. We have more doctors, more hospitals than any other country. We have a Walgreens, a Rite Aid, and a CVS on every corner. Okay? Watch this. There's a way that seems right to man, but in the end leads to death. There's a right way that seems right to man, but in the end leads to death. More doctors, more hospitals, Walgreens, CVS. We rank second to last for overall health in this country. How does that make sense? What's that? More funeral homes, right. So, what's the goal? Understand this. What's the third? Here's the first and second disease killers: heart disease and cancer. What's the third leading cause of death in this country? No, I'll talk about diabetes. I'll talk about it because I know people want to know about it. The third leading cause of preventable death in this country, Dr. Riley, prescription medication. Watch this. 7 times more people die from prescription drugs than heroin, crack, street handguns, car accidents, and cocaine combined. In this country, we have a pill for every ill and a potion for every emotion. The number 1 drug sold for this today is for depression. Every single shooting in school, some types of Ritalin or Prozac, or some type of mind-altering drug. Now, there's a time and a place for medicine. Medicine saved my parents' lives. Medicine saves lives. What we're against is overuse, misuse, and abuse of the medication. Okay? And some of you come here with back, raise the hand with the neck pain again. Neck pain and lower back pain. Here's what happens. Okay? What normally happens is that when you have some type of pain, something is usually putting pressure on a nerve. Okay? If I borrow your hand? It's a pretty hand. Okay, watch this. Make believe this is a nerve right here. If you have any type of neck pain, headaches, lower back pain, or tingling or numbness in your hands and feet, something is putting pressure on one of 2 things. The most important thing it usually is a nerve. Okay? If you have a toothache, what's it hitting? A nerve. If she punches me in the arm, it hurts my arm because it hits a nerve. If you kick me in the leg, it hurts because it hits a nerve. So when you have pain, that's hitting a nerve. So guess what? No doctor can treat what they can't diagnose. So the first thing we need to diagnose is find out what's putting pressure on the nerve. Anybody here have an X-ray and MRI? Okay. So we need to find out what's putting pressure on the nerve. It could be a muscle, a tight muscle can hit a nerve. A ligament, it can be arthritis, it can be degeneration. Does anybody here feel more pain in the morning and works itself out during the day? Okay. The number one sign of some type of degeneration or some type of arthritis is people say, I feel pain in the morning, and like the Wizard of Oz, the Tin Man, as they start to move during the day, they feel looser. But guess what? We know there's certain foods that can decrease inflammation in your body. That's why every patient who comes to our office, listen, this is not a sales pitch. We don't need more new patients. We're here to teach people. Okay, at the end, we give you an opportunity if you want to speak to Dr. Riley or myself. But watch this. If you have pain and you have swelling or tightness in the morning, it's usually some type of degeneration, and foods can play a role in that. It was said this, let food be your medicine and medicine be your food. Okay? And most people in this country are more overweight and undernourished than ever before. Watch this one. It's better to be a little bit overweight and in shape than thin and out of shape. We want you to become healthier, not just lighter. There's a lot of people who are thin and smoke crack. There's a lot of thin people in the cancer ward. Just because you're thin doesn't mean you're healthy. We need you to become leaner, not just lighter. There's a difference. Everybody get that? Just because you're thin doesn't mean you're healthy. People go, Dr. Kaner, and in our office, we work in an integrated office. It's Dr. Riley's my medical director. We have a nutritionist. We have an acupuncturist. Every person who comes in, guess what we do? We take our time with, and we don't rush you in and rush you out like a lot of doctors do. Because most doctors don't sit there and take time with you. They don't treat you the same. But you have to understand this. God gives you one body, and you got to take care of your body. We're supposed to be good stewards, good custodians of our body. And most people don't realize how important their health is until they lose it. We're supposed to live 80 years of good health in this country. But it doesn't happen. Who spoke about diabetes? You did? Okay. Anybody understand type 2 diabetes? Okay. Type 2 diabetes is also called adult onset. It's a man-made disease. Type 2 diabetes is called adult onset, but the problem with it is that our children are getting it today. And I have a lot of parents that will come in and go, Dr. Riley, Dr. Kaner, will you sit with me and talk to me about my kids and what they're eating? And I go, nope. Yes, sir.
You said it's a man-made disease.
Yeah, type 2 diabetes, not type 1. Type 1 is the problem with the pancreas, right? Type 2 diabetes is called adult onset. It mostly has to do with foods, nutrition, and lack of exercise. Type 2 diabetes, people say, well, our kids are getting it today. Today, our kids, almost 3 out of 1 children in this country today is overweight. And our kids are developing type 2 diabetes. The problem with type 2 diabetes is this. You get something called diabetic retinopathy. It affects your eyes. You get something called diabetic neuropathy, where you lose the sensations in your feet. Doctors went to school. Listen, we love what we do. But it gets us upset sometimes if you see people coming in and they actually have to remove a body part. Right? And they have to cut toes off. It's awful. I don't believe God gave you any spare parts. But understand this, with type 2 diabetes, it's not usually a pancreas problem. And the most addictive drug besides mind-altering drugs is sugar. Sugar is one of the hardest drugs to get off of. Yes, it is. And that's why it's important to hire people that help reach your health potential. But what happens is it's not a diabetic problem. We don't have a spiritual and emotional problem or physical problem. What we have is a lifestyle problem. See, most people lifestyle themselves to death. So you don't need any help to heal. And I know type 2 diabetes is almost 95% curable. But it's based on people's lifestyle. When you speak to Dr. Riley and myself, because hopefully when you're done, you'll give us an opportunity to work with you one-on-one. As I tell a lot of people, and we treat people the same way we do here, is I'll tell people, I love you, I want to take care of you, I want you to help yourself. Most people don't take care of themselves the way they should, and that's without judgment. but most people have a lifestyle problem, or they, what I call, stop digging your own grave with your own fork. How out of control are you in your own life that you can't control about what you put in your mouth? It's more important actually what comes out of your mouth than what goes into your mouth. Right? It's very important. Right? And if one part in your body suffers, what happens? All of the parts suffer with it. Right? Everything might be permissible for you to eat, but that doesn't mean it's always beneficial. And don't tell me it's always natural. Because a lot of natural things aren't as good for you, because what is natural that can kill you? Cyanide. People go, it's natural, it must be good for me. Not always. Right? And especially if you're type 2 diabetic and you don't always know that certain fruits have a high amount of sugar in it. So just because everything is pulled from the ground or plucked from a tree, that your body knows what to do when it comes to nutrition, doesn't mean it's always good for you. If you pinch, and how many people here have low back pain? More than half the room. Here's what happens when you're in pain. And understand this, pain is your body's way of telling you there's something wrong. But what happens when you're in pain, this is what happens. When you're in pain, it makes you moody. When you're in pain, you can't enjoy the things you want to do. You can't play with your kids, your grandkids. I know it hurts when you're in pain that you get up in the morning and you feel like you're 120. When you're in pain, you can't play with kids, you can't play golf. When you're in pain, you can't sit long. How many people have more pain when they sit than when they stand? That's a sign. I love when people come here and they go, talk to him, talk to her. Right, when you have more pain when you sit, that's an indication that there's a possible disc problem. Oh, can I borrow your hand again? Okay. Here's what a disc does. A disc acts as a cushion to protect the most important structure in your body, the nerves. Right? So here's a picture. This is not an old patient. This is a disc. The only reason God gives you this disc is to protect the spinal cord and the nerve. But if you have more pain when you sit, if it hurts when you cough, you sneeze, you're getting up, that's a sign that the disc is putting pressure on a nerve. So guess what? Now we know what to do to fix you. How many people here have gone for physical therapy? Okay. Make you better or you worse? Some people say better, some people say worse. Guess what? In our office, we have a PT. We do therapy. We also call PT physical terrorists. Because certain people say, I come back and I feel worse. And certain people have gone to a chiropractor and felt worse. Certain people have taken pills, and we know every drug goes through your liver and your what? Kidney. And dialysis is no way to go through life. But when you're in pain, it changes people's moods. When you're in pain, your adrenal gland, it raises your blood. How many people have high blood pressure? Okay. When you're in pain, besides it changing your personality, yeah. When you're in pain, how come you didn't bring home orange juice? Why are you so mad all the time? Because people are in pain. When you're mad, it changes your personality. It changes your relationships. When you're in pain, you're not who you're supposed to be. People are smiling at each other. When you're in pain, you lose your patience. When you're in pain and you have headaches, you have back pain, you're lying down, you're missing family functions. People get headaches so bad, the light bulbs, they want to throw up. When you're in pain, it raises your blood pressure. Above your kidneys, you have two glands. They're called your adrenal glands. It produces adrenaline. It raises blood pressure. So when you're in pain, people think, oh, I'm just going to take a pain killer or a pain pill. That just covers up the symptom. It doesn't fix it. How many people here have gotten cortisone injections? Okay. And I understand this. We want to start conservative with you. We want to start things that have no side effects. Then, listen, I'm not egotistical, but I'm confident. And I've been working in Fairlawn for 18 years. In 18 years, I've had maybe 4 people ever need surgery. And that's a good batting average. But we're also honest. If we can't help you, we're going to go, I love you, but this is the office you probably should go to. And if we can't help you, go, we can't help you, but this is where you need to go. We don't believe every doctor should take every patient. And we don't believe every patient needs pills. Okay? Most people need what's called active health care. And I'm going to sit with you and go, are you going to the bathroom every night? What are you eating? Are you exercising? Because the moment you start to exercise, the moment you take pressure off a nerve, your body heals better, it functions better. You cut your finger, it heals. Your body's a self-healing, self-regulating, self-perpetuating organism. Your body can heal itself. Your body doesn't need any help to heal. You know how it gets messed up? From what we do. From the foods we eat, from how we think, from us not taking care of ourselves. But most doctors won't tell you that. They'll just say, take the green ones. The green ones don't work, try the red ones. Red ones don't work, try the blue ones again. And what does this mean? Well, you know when medication comes off, and listen, we prescribe medication in our office at a limited dose. But when do drugs come off the market? When do medications come off the market?
Replaced.
What's that?
It's replaced.
It's replaced, but why does it usually get replaced? Because people have side effects and can die. Okay, when bodies accumulate is when medications usually come off the market. And don't get me wrong, pharmaceutical companies at times have certain amounts of money. Any pharmaceutical reps here? Okay. What I'm saying is that what happens is that they set certain money aside for lawsuits. But when you're in pain, it raises your blood pressure. So you want to get out of pain and you want to fix your body. And it comes down to you really understanding this, especially when it comes to cortisone. When it comes to cortisone, what happens is that it eats away a joint. Cortisone eats blood. Blood is made where, Doc? In the bone. So when you take cortisone over time, one, it eats away the joint and can cause arthritis. Number two, cortisone raises blood sugar. It raises blood sugar, cortisone. Cortisone also in women can cause something called osteopenia, which loses your bone and your minerals, would lead something called osteoporosis. Right. Do we use cortisone? Sometimes. But we use something called Tramil, which comes from an aloe vera plant. And it has something called chamomile in it, which gets rid of pain, gets rid of inflammation, and it also can help lubricate knees for people who have knee pain. Guess what the side effect is? There is no side effect. Is it done one time? No, usually it's done like 2 or 3 times. It has to be cumulative, just like exercising, just like eating right. Okay? What I'm going to do is this. I'm going to give you time to answer questions. Okay? So myself and Dr. Riley are going to come around because I know they're going to bring out your food. I'm going to end on this note. You have forms here. Okay? And some of these forms we're going to ask you to fill out for this. No one's going to email you. No one's going to call you. No one's going to bother you. If you came here for the right reason tonight, which is to get better, and you're sick or tired of being sick or tired, and you want to have more control over your health, and you want to feel better, because let me tell you something. When people are healthier, they're happier. You know what's normal in this country? Normal, this is not what's supposed to be, is people go, how are you? Well, I go to work and I hate the people I work with. And I'm on 12 different medications, or 4 different medications, and I don't have energy. And people go, that's normal. That's not normal. We're supposed to be healthy. We're supposed to be happy. All right? The people taking the most medication in this country are never the healthiest, they're the sickest. You can't buy health in a bottle. You can't. You got to do the things that will get you healthier. And it's already January 12th. And by this time, I already told you, we're 8 days past the time where people lose their New Year's resolution. You have to be committed to your health, because most of us have bad habits. See, our habits can be our best friend or our worst enemy. First you make your habit, and your habit makes you. And if you're used to being in pain, and you don't want to change anything about it, or you're used to going to the same doctor, you don't want to do it, at one point in your life you go, what else can I do? Am I going to say one thing that's going to help you get healthier? I hope you learn 3 things. But I'm going to tell you from this one I did from the beginning, your health is the most important thing you have. Without it, you have nothing. When you're healthier, you're happier. You have less aches, less pains. Your body digests food. It processes food. You should be sleeping through the night. How many people here don't sleep through the night? Okay. When Dr. Riley and I work with you, there's 2 questions we ask, and I'll give you some time before you bring your food. Are you pooping every day? Do you have a bowel movement every day? Because I'm telling you right now, if you're not having a bowel movement every day, it means your body's holding in toxins, and it can weaken your immune system. Okay. Are you sleeping? When does your body heal the most? When you sleep. So if you're not sleeping, you're not going to the bathroom on a regular basis, that's very important to us. Okay? So what I'm going to do is I'm going to give you a chance to Barbara. You ever go to a doctor's office? Oh, you just woke me up. You ever go to a doctor's office where the person at the front desk is not nice? Okay. Well, we don't work with anybody like that. And guess what? My mom is still here. Dr. Riley's mom is still here. We do the right thing. That's Barbara who works in our office. She's right there. Everyone in our office is friendly. Okay? What we're going to do is this. We're going to give you a chance to come in, and this is what we do. We do this for 4 days because we go to different corporations and companies. We give you a chance to come in and speak with us. Here's how long it takes. 30 minutes. 30 minutes. My time is important, so is yours. When you go to a doctor and you have to wait 45 minutes to 2 hours, we don't do that. That's Barbara who runs our office. She's nice, and so am I, and all the other doctors there. It takes 30 minutes for the evaluation. When do we do it? For the next 4 days. We do it Wednesday and Thursday, and next Monday and Tuesday. Barbara's going to come around and ask if you want an appointment. It takes 30 minutes. Here's the cost. Okay? The cost is that we don't charge for the first 2 times you're there. I'll say it again. We don't charge for the first 2 times you're there. We do a consultation with you, a history. What's your family history? Do you sleep through the night? What are you eating? Where's your aches? Where's your pains? Do you have difficulty opening up a jar or a bag? Do you have more pain in the morning? Does it feel like tingling or numbness in your arms or in your feet? We do a full history with you. And if we can help you, we tell you. If we can't, we tell you, we love you. This is where you probably need to go to. And then you'll leave here and go, you know what? Those guys were next to Johnny and Handers, the hot dog place, right? You're like, those guys were really nice and they were honest with me. And that's the reputation we have. Because your reputation can develop you or what? Destroy you. So we'd rather you leave here and go, they did the right thing. So the evaluations are done for the next 4 days. The first 2 times you're there, there's no charge out of pocket. Why? Because a lot of people who come in today, unfortunately, not everybody has health insurance. And a lot of people go, I wish I could go to a doctor. Or people have insurance, but they have co-payments that are $20, $30, $40, $50. Okay? So for the first 2 visits, there's no charge. Please don't do this. And this is out of the utmost respect for the same thing that way you want to be treated, because they're going to bring you food. Please don't make an appointment and then go and then not show up or not like even give the courtesy of calling. There's a lot of people who sometimes need our help, and just if you want the appointment, keep it, just so you're not taking an appointment from somebody else. But if you want to get healthy, if you want to take the right steps, then you need a health office, not just a medication office. Okay? We do it for the next 4 days. If you want to make an appointment, Barbara's going to come around. You can make the appointments with her. Be courteous also, because sometimes we've done this before and people go, I wanted to bring my boyfriend. I wanted to bring my friends. If you want to bring them in, please just tell Barbara so she can give them a time slot. Because otherwise, we get yelled at by Barbara. And I don't want to make you wait. So again, thank you for having me. Thank you for letting me give you. I hope you learned something. Dr. Riley is going to come around or answer any questions you have. And Barbara's going to come around. She does it for the next 4 days. It takes a half hour. We're right up the street. And I hope you guys enjoy your meal. Thank you. Yeah. This will be shut this off. Yeah.